Welkom terug by die groot ontbyt. As deel van borskanker-bewusmakingsmaand gesels ons vanmôre met spesialis-sjirurg Dr. Fatima Hoosain. Ons praat bietjie oor kulturele stigmas rondom borskanker en hoe belangrik dit is om te gaan vir jou ondersoek. Good morning, doctor.
Good morning. Thank you for having me today.
It's great chatting to you this morning. It is Breast Cancer Awareness Month, but in South Africa, what inspires this focus on breast cancer specifically for you in this month?
For me, my history starts when I was really young. My mom was diagnosed with breast cancer. She was a carrier of a genetic mutation that increased her risk of developing breast cancer. Unfortunately, she succumbed to the disease in 2012. And I think my experience with the disease at such a young age inspired me just to do something better for her and for the people that are or suffering from the disease. Just want them to have a better experience. It doesn't need to be as bad. It doesn't need to be as awful. It can be a journey that is quite tolerable.
Dr. Fatima, a recent study showed that 63%, just over 63% of patients of African descent are diagnosed at quite a late stage, stage 3 or 4. Why does it present so late?
Well, there's a lot of issues there. One is the perception that breast cancer doesn't happen to certain people, and so they don't check, they don't know about breast cancer, they don't do breast self-examination, and of course, in rural populations and people without access to the screening, for example, like those in the private healthcare sector, they just don't get diagnosed early. And of course, a lot of people think that this is something that is like witchcraft, it's a sin, it was something that they were cursed with. So then they don't necessarily go and seek help from the correct healthcare provider early. And this all leads up to the delay. Of course, there's transport, financial issues are is a major issue. They don't have money to get transport to the healthcare facilities, which is another issue. So for rural healthcare seekers, they have just a mounting amount of issues, one after the other, that ends up leading to the delay in diagnosis.
Dr. Fatima, is there an increased frequency in breast cancer diagnosis?
At the moment, that's what we are seeing. The question is whether it's related to just more people becoming aware and seeking help, getting screening early, or whether it is our environment that we live in. So more people being diagnosed because more people are getting the disease. And
Sure.
I think it's a combination of both, obviously.
How do we get rid of these cultural stigmas, misconceptions about breast cancer? Because it is such a big issue and something that should really be addressed. How do we break those stigmas?
I think this is a very important start. I mean, having these conversations to tell people that, listen, this is not something that you asked for. This is not something that was done to you. This is something that happens. It's a disease, exactly like high blood pressure and diabetes, like cholesterol. You go to the doctor to seek medical help for those diseases. You take your tablets for that. It's a chronic disease. So why not get the correct treatment and medication that is required for breast cancer? And by all means, we are moving towards breast cancer becoming more like a chronic disease because there are so many options in terms of treatment for breast cancer. So having these conversations, breaking it down for people, especially the older generations where I think you probably heard, if you cut into the cancer, it's going to spread immediately. We didn't have as good treatment options available there. So that is why patients often develop metastases after they were operated on. maybe we didn't even know there was metastasis at the diagnosis. So I think these are all things that we need to have discussions about. We need to break it down. We need to start making breast cancer something far more approachable rather than like, okay, I have breast cancer, I'm going to die immediately. It doesn't work that way anymore.
Apart from the education, obviously a support structure, a system to support people with breast cancer is critical and is also
Yes.
a critical part of the healing process. Is that not correct?
That is absolutely correct. And you know what's important is that a lot of people still think that if they lose their breast, they are going to be half of a woman, or they're going to be less of a woman, or not as beautiful. You are way more than just a part of you. Women are I think we are a little bit too critical about ourselves. And in terms of seeking health, I think when we have breast cancer, if you need a mastectomy, which is not always the treatment that is required, it's not always the best treatment for the patient. It is for your health. And I think to have that kind of procedure, you are brave. It makes you more of a woman. It makes you, we should look at those women as amazing and great because they have survived this ordeal. And I think that if the more of us that express that opinion and look at it like that, the more likely that people are going to seek help earlier, because it changes the way they see themselves as well.
Perhaps you can tell us something about the importance of self-examination and finding those abnormalities.
So, like I said earlier, the majority of the South African population don't have access to screening. The public healthcare sector doesn't offer screening services, so it's mostly on a diagnostic basis. So for those patients, it is absolutely fundamental to self-examine, because that's how they're going to diagnose the cancer. And self-examination is simple. You do it 10 days after your menstrual cycle. And for those people who don't get their menses, choose a date in the month and do it once a month, every month. Best place to do it is in the shower. And I mean, these are the boobs that we were born with. We should be really comfortable with them. We feel our legs and our arms and our head and our hair. So why not feel your breasts? And just to see what's normal, what's your normal, and then see what's different from that. And of course, if you find something that's abnormal, go to seek help immediately. I think the biggest issue in that regard is that people think, oh, here's a lump. I'm just going to wait a little while and then hopefully it will disappear. And then a little while is 3 months, 6 months, and then suddenly it's like 5 times the size. So the very thing that you were afraid of, you have ultimately manifested. And we're trying to get early detection, because that's when we can save the life. That's when we can save the breast. And if that's what people want, then, of course, earlier arrival at the healthcare provider is probably the best idea.
Dr. Fatima, thank you so much for joining us this morning. And it's lovely to hear you also saying that women that fight the good fight against breast cancer, all of them are more women than they were before they had it. And it's amazing to think of that. And a choice for treatment is a positive choice. It's a positive choice for your health. There's nothing negative to that. Thank you so much for being here this morning.
Thank you very much for having me.
Daar sê Dr. Fatima Hoosain. Nou ja, eystervrou, daar is so 'n woord vir 'n rede. En elke vrou wat deur borskanker gaan is 'n eystervrou. Nou, as ons terugkom net na die advertensiebreek, dan gesels ons verder en later kuier ons ook met 'n kunstenaar.